Have you ever secretly wondered, is my size normal? You're not alone. It's one of the most searched questions on the internet and one of the most misunderstood. Today, we're cutting through the myths and misinformation to bring you real science-backed answers about penis size. We'll talk about what's considered medically normal, how to measure correctly, what science says about averages, and even explore enhancement procedures and their risks. And stick around till the end, we'll take a surprising trip through history that might completely change how you see yourself. Part 1, Body Image vs. Reality. Let's begin with something that might shock you. Over 95% of men who are anxious about their penis size are actually within the normal medical range. That's right. The problem usually isn't physical, it's psychological. Many men struggle with a distorted body image because of unrealistic comparisons, especially with adult films and online content where bodies are often exaggerated or digitally altered. What's even more interesting is that while 55% of men say they feel anxious or dissatisfied about their size, only 5 to 10% of women say it's something they care deeply about in a partner. This disconnect between male anxiety and actual female concern is enormous. Part 2, how to measure correctly length and girth. If you're going to compare, at least do it right. Penis size is measured in 2 dimensions, length and girth or circumference. Measuring length. Length can be measured in 2 ways, erect, flaccid, and stretched. In clinical settings, flaccid stretched length is the most accurate predictor of erect size. Here's how to do it correctly. Use a ruler or measuring tape. Press it against the pubic bone, not just the skin. This means pushing slightly through any fat pad. Stretch the penis out gently but firmly flaccid, and measure from the base to the tip of the glans, head. For erect measurements, the same applies. Ruler on top, base to tip, aligned with the shaft, not underneath. Measuring girth. Girth matters too, and here's how to measure it. Use a soft tape measure or string. Wrap it around the middle of the shaft, not too close to the base or the tip. Record where the ends meet. Again, you can measure both flaccid and erect, but erect girth is the standard used in research. Part 3, what the scientists said why real numbers. Now that you know how to measure correctly, let's talk about the numbers. A large-scale meta-analysis involving data from nearly 15,000 men worldwide gives us the most reliable averages we have to date. Length, erect or flaccid stretched. Normal range, 10 to 16 centimeters, 4 to 6.3 inches. Global average, 13.2 centimeters, just over 5 inches. Girth, erect. Normal range, 10 to 13 centimeters, 3.9 to 5.1 inches. Average, 11.5 centimeters, 4.5 inches. Definitions for outliers. Micropenis, erect or stretched length of less than 7.5 centimeters, 3 inches. Macropenis, rare, typically above 24 centimeters, 9.5 inches. So if your measurements fall anywhere between these ranges, you're within what science defines as normal. Part 4, why anxiety is common and misleading. Many men still feel small even when they're average. Why? Because comparisons are often made in misleading ways, comparing your flaccid size to someone else's erect size, for example, or being influenced by exaggerated depictions in adult films. Angles, lighting, and even digital enhancement distort reality. It's also worth noting, when surveyed anonymously, most women say size is much less important than things like emotional connection, communication, and confidence. Part 5, enhancement procedures, what works, what doesn't. With insecurity comes marketing. A growing number of clinics now offer cosmetic enhancement procedures, but many are misleading, ineffective, or even dangerous. Girth injections, hyaluronic acid. This is one of the most commonly used substances in cosmetic penis fillers. Adds 2 to 3 centimeters in girth. Lasts around 12 to 18 months. Absorbed naturally by the body. Considered relatively safe if performed by trained professionals. But beware. Some clinics use non-absorbable materials like PMMA, polymethylmethacrete, or silicone, which can cause hard lumps or nodules, chronic inflammation, tissue deformation, irreversible damage, lengthening surgery, Options for increasing length are limited and come with higher risk. Liposuction of the pubic area removes fat, making more of the shaft visible, but doesn't change actual length. Suspensory ligament release adds 2 to 2.5 centimeters in flaccid length, no change in erect size. Possible side effects: instability during intercourse, scar tissue, loss of angle. Penile implants. Often misunderstood, they're used to treat erectile dysfunction, not to increase size, and are reserved for medical cases, not cosmetic ones. Important: there is no approved permanent surgical procedure for penis lengthening endorsed by major medical organizations. Part 6. The history no one talks about. Let's zoom out for a moment. Did you know that in ancient Greece, the ideal male body was depicted with a small penis? It symbolized wisdom, discipline, and intellect. Large penises were shown only in satire, comedy, or associated with wild, irrational, or barbaric characters. Just look at classical sculptures of gods and philosophers. What you don't see is oversized anatomy. This tells us something important. Cultural standards of masculinity shift. What seems ideal today might not be tomorrow. Let's bring it all together. If you've ever felt insecure, anxious, or pressured about your size, you're not broken. You're human, but chances are you're already within the range of what's considered completely normal. Size doesn't determine your value, your attractiveness, or your masculinity. What matters is how you treat others and how you treat yourself. So breathe easy. You don't need to change your body to be enough. You already are.